Hello all, myself Angel M.Sc Nursing, Assistant Professor, Department of Mental Health Nursing, ES College of Nursing in Vilupuram. Now I am going to present the Schizophrenia. Introduction. Schizophrenia, it is a psychotic condition. Schizophrenia, it is a type of typical functional psychosis. In schizophrenia, it is a serial mental disorder that can have a serious effect on the person physical and mental well-being. The first coined a schizophrenia word by the Swiss psychiatrist EUGEN BLEULER in 1908. It is described schizo means split, phrenia means mind. It is a Greek word which is the meaning of split of mind. Next, definition. It is a psychotic condition characterized by a disturbance in thinking, emotion, volition and faculties in the presence of clear consciousness, which usually leads to social withdrawal. The psychotic schizophrenia, it is a psychotic major condition, and in this world it is characterized by the effect of cognitive functioning like thinking, emotion, volition and faculties. Volition means the person inability to work and function like other people, and faculties is the person enabled to think clearly, but the person having the presence of clear consciousness and also the social withdrawal. It is called as a schizophrenia. Next, etiological factors. Etiological factors, there are 4 etiological factors presenting in schizophrenia. First one is biological factor. The biological factors explained including a biochemical, neurostructural, genetic, prenatal risk factor, psychodynamic, developmental theories and family theories. Vulnerability stress model. Fourth one is social factors. In biological, explain including a biochemical changes. The some studies or explaining a biochemical changes, for example of increasing dopamine level, it will cause a schizophrenia, and abnormalities, some neurotransmitters will develop a schizophrenic like non-epinephrine, acetylcholine, kappa aminobutyric acid, and also neuroregulators also including developing the causes of schizophrenia like prostaglandin and endorphin. And second one is genetic factors. In genetic factors, monozygotic twins are affected than the dizygotic twins, and commonly consanguineous marriage will cause the schizophrenia. Neurostructural. Neurostructural CT and MRI shows the not fully development of the neurostructure like increased size of sulci surface on the brain and decreased brain volume, and the lateral and third ventricle, large lateral, it is not fully development, and atrophy in frontal lobe, cerebellum and limbic system. And fourth one is prenatal risk factors. In prenatal risk factors, for example of the mother having the maternal influenza will cause a schizophrenia at the birth of child. Late winter and early spring will develop a schizophrenic condition, and a complication of pregnancy during labor and delivery, it will cause the schizophrenia. And second one is psychodynamic. In psychodynamic, there are 2 theories presenting. One is developmental theory and second one is family theory. In developmental theory, according to Freud, there is a regression to the person over a stage of psychosexual development with the use of defense mechanism of denial, projection, reaction formation. The individual have a ego boundaries, superego, inadequate ego boundaries, and a regressed ego behavior, love, hate relationship, and arrested the psychosexual development. Family theory. In the family theory, the major influencing of the schizophrenia developing the in family system. One is mother-child relationship. If the patient having the schizophrenia, the mother will get a schizophrenic condition for like the overproduction and a cold warmth producing by the mother. The baby will get the schizophrenia in future, and also the dysfunctional functional family system. Hostility parents can lead to the schizophrenic doctor and develop double blind communication. Parents convey two or more conflict and incomplete message in the same times. Third one is vulnerability stress model. Vulnerability stress model, according to the model, people with the predisposition to schizophrenia may avoid the serious mental disorder if they are protecting from the stress. The individual with the similar vulnerable may develop to schizophrenia if exposed to the stressors. Fourth one is social factors. In social factors, schizophrenia is more prevalent to area of social mobility and disorganization, especially among members of the very low social classes. Next, we will see the clinical features. In clinical features, the EUGEN BLEULER coined the 4 A's. First one is affective disturbances. In affective disturbances means inability to show appropriate emotional response a person. Autistic thinking. Autistic thinking means a preoccupation. The person will have a concern of external environment. Next, ambivalence. Ambivalence means a coexisting of two opposing desires, thinking, emotion. The person having in the same settings, same feelings. And also affective looseness. Affective looseness means the person inability to think logically. And positive and negative symptoms. Positive symptoms, first one is delusion. Delusion, it is the meaning of a false unshakable belief. And hallucination. Hallucination means misperception without external stimuli. There are 5 types of hallucination in that 2 major hallucination presenting in schizophrenia. One is auditory hallucination, second one is visual hallucination. There are 3 hallucination less common in schizophrenia. Third one is excitement or agitation. Agitation means the person having anxiety with motor restlessness. It is presenting in severe motor restlessness. It is called as agitation. Fourth one is hostility or aggressive behavior. Fifth one is suspicious and ideas of reference. Sixth one is possible suicidal tendencies. Negative symptoms, first one is affective flattening or blunting. Second one is evolution, apathy. Apathy means lack of initiative. Third one is attentional impairment. Fourth one is anhedonia, inability to experience pressure. Fifth one is alogia, lack of speech output. Next, thought and speech disorder. Autistic thinking, preoccupation, totally removing a person from the reality. Loss of associations, a pattern of spontaneous speech in which lack of meaningful relationship with each other. thought blocking, sudden interruption in the thought process. Neologism, a word newly coined or an everyday word used in a special way, not readily understood by others. Poverty of speech, decrease speech protection. Poverty of ideation, speech amount is adequate but content conveys little information. Echolalia, echolalia means repetition of the word or phrases. Perseverance, persistent repetition of words or themselves beyond the point of relevance. Verbication, senseless repetition of some words or phrases over and over again. Disorder of perception. Disorder of perception presenting the two types of hallucination. One is auditory hallucination, second one is visual hallucination. Disorder of affect. Disorder of affect including the apathy, emotional blunting, emotional shallowness, anhedonia, inappropriate emotional responses. Disorder of motor behavior, increase and decreased in psychomotor activity, decreased self-care and poor grooming are common features presenting in the schizophrenia. Other features, decreased functioning, work, social relations and self-care as compared to earlier life. Loss of ego boundaries, it will develop, and the loss of insight, poor judgment. Suicide can occur due to the presence of associated depression. And see the diagnosis. The nurse should collect the history collection and physical examination completely. We should advise the blood and urine examination, CT and MRI scan, and under that we diagnosed based on the ICD criteria. Treatment. First one is pharmacological treatment, second one is electroconvulsive therapy, third one is psychotherapy, fourth one is nursing management. Pharmacological therapy, first we should advise the conventional antipsychotic drug. We should administer the antipsychotic drugs, for example of chlorpromazine 300 to 1500 mg per orally daily, fluoxetine decoordinate 25 to 50 mg administer IM 1 to 3 weeks continuously, and haloperidol 5 to 100 mg per daily orally administered, 5 to 20 mg per daily the route of administering the intramuscular site. Next, trifluoxetine 15 to 16 mg per day administering in orally, 1 to 5 mg per day administering in the route of intramuscular site. Commonly used the atypical antipsychotic like clonazepam 25 to 450 mg per day administering in orally, risperidone 2 to 10 mg administering daily, clonazepam 10 to 20 mg per daily, quetiapine 150 to 750 mg per daily, zifrazidine 20 to 80 mg per day administering in orally. Next, electroconvulsive therapy. Electroconvulsive therapy administering for the classification of schizophrenia, mainly in catatonic schizophrenia. The patient having the catatonic stupor, if the patient having the uncontrolled catatonic excitement, and the patient having the having extrapyramidal syndrome and antipsychotic or antidepressive drug side effect of those drugs, we should administering the electroconvulsive therapy. Psychological therapy. First one is group therapy, the social interaction, sense of unit, identification and reality testing achieved within a group setting have proved to the heavily therapeutic for these individuals. Behavioral therapy. The behavioral therapy, the main goal is increase the adaptive behavior and decrease the maladaptive behavior. Behavior therapy is the useful in decreased the frequency of distributing behavior and increase the appropriate behavior. Family therapy. Family therapy typically consists of the brief program of family education about schizophrenia. It has been found that relapse rate of schizophrenia are higher in the families with high expressed emotion, where significant other makes critical commands, expressed hostility, and shows emotional over involvement. Social skill training. Social skill training address behaviors such as poor eye contact, odd facial expressions, and lack of spontaneity in social situation through the use of videotapes, role play, and homework assignments. Psychosocial rehabilitation. It includes activity therapy to develop the work habit, training in the new vocation, or retaining in the previous skill, vocational guidance, and independent job placement. Cognitive therapy used to improve cognitive distortion like reducing distractibility and correcting judgment. Fourth one is nursing management. The nurse should check the patient baseline data in detail to check the vital signs, to administer the medication with physician order, check side effects of antipsychotic drugs, to avoid, manage and the short instrument nearby the patient, to administer the ECT and management of the pre, during and post ECT room nursing management care, and keep the restraints because of during violent and aggressive behavior. Advice to take fiber-rich diet and more amount of water, maintaining the input and output chart, maintain personalization of the patient, explain the patient conditions, side effects of the patient condition and follow-up care. Finally, recording and reporting. We all see the schizophrenia in detail. Thank you.